May 2007, Alexandria, Virginia. In a quiet federal courtroom, executives from Purdue Pharma admitted they had misled the public about the safety of OxyContin. But the real power behind the company, the Sackler family, was nowhere to be seen. While the U.S. was spiraling into an opioid epidemic, they remained behind the scenes, insulated by philanthropy, prestige, and silence. This is the story of how one family didn't just sell a drug, they bought control of an entire industry, one prescription at a time. Long before OxyContin, before lawsuits and overdose headlines, there were three brothers, Arthur, Raymond, and Mortimer Sackler. Born to Jewish immigrants in early 20th century Brooklyn, they came of age with ambitions sharpened by adversity. All three became doctors, but Arthur, the eldest, would shape not only their future, but the entire pharmaceutical industry. Arthur Sackler didn't just practice medicine, he understood messaging. In the 1940s, while working as a psychiatrist, he also ran an ad agency on the side, one that catered specifically to pharmaceutical companies. At the time, drug ads were dry, clinical, and aimed at institutions. Arthur changed that. He pioneered direct-to-doctor marketing, creating emotional, persuasive ad campaigns that targeted physicians directly. He used repetition, charts, testimonials, and a tone of medical authority. His work turned Pfizer's terramycin into a bestseller and helped reshape how pharmaceutical companies thought about sales. His golden rule was simple: influence the prescriber, and you control the market. In 1952, Arthur and his brothers purchased a small pharmaceutical company called Purdue Pharma. It made earwax remover and antiseptics, not exactly revolutionary products, but Arthur saw potential. The plan wasn't to invent miracle drugs. It was to market existing ones better than anyone else. He also pioneered another tactic: publishing. Arthur acquired a controlling interest in the Medical Tribune, a newspaper mailed free to hundreds of thousands of doctors. It featured articles, studies, and, conveniently, ads placed by his agency. The line between education and marketing blurred, and the model worked. Arthur died in 1987 before OxyContin existed, but his playbook didn't. His brothers Raymond and Mortimer, and later their children, inherited the company, the philosophy, and the empire he'd begun to build. Under their control, Purdue Pharma was rebranded as Purdue Pharma. By the 1990s, the Sacklers were ready to pivot into a new market: pain. Chronic pain was increasingly being recognized as undertreated by the medical establishment. The Sacklers saw a gap and an opportunity. They weren't alone. Other pharma companies were developing synthetic opioids, but Purdue had something the others didn't: a blueprint for how to sell it. The drug would come later, but the system was already in place. The advertising, the medical outreach, the speaker programs, the clinical papers written to support sales messaging, it all traced back to Arthur's original insight. You don't need to sell the best product. You just need to convince the gatekeepers that you have. In 1996, Purdue Pharma launched the drug that would define its legacy, OxyContin. It was introduced as a breakthrough, a long-acting opioid painkiller that delivered up to 12 hours of relief with each dose. The active ingredient, oxycodone, wasn't new, but Purdue's patented time-release coating was. The company claimed it made the drug safer, less prone to abuse and addiction, because the opioid would be absorbed slowly over time, rather than hitting the bloodstream all at once. That claim became the foundation of their marketing campaign, and it was a lie. Purdue's internal data already showed that many patients reported the drug wearing off early, sometimes in just 6 or 8 hours. When the effects faded, patients experienced withdrawal-like symptoms and craved the next dose. Doctors were encouraged to respond not by questioning the drug's design, but by increasing the dosage. More pills, higher strength, stronger dependency. The Sacklers didn't just rely on ads, they mobilized an army. Sales reps were trained to downplay addiction risks and push the message of low abuse potential. They were incentivized with aggressive bonuses based on the volume of OxyContin prescribed in their territories. One internal slogan used by Purdue's sales team: "Start with Oxy, stay with Oxy." Purdue targeted not just pain specialists, but primary care physicians, many of whom had little training in pain management or opioid risk. The company also produced glossy brochures and videos featuring reassuring doctors and grateful patients. They sent thousands of branded promotional materials to clinics and hospitals. And when addiction stories began surfacing, Purdue doubled down. Their narrative was clear. Abuse wasn't a drug problem, it was a patient problem. The company suggested that those becoming addicted were already predisposed to substance abuse, ignoring the mounting evidence that the drug itself was being misused on a massive scale. To reinforce the illusion of safety, Purdue selectively funded medical research and pain organizations that echoed its messaging. They used data that excluded high-risk patients or ignored long-term use. Some doctors, now receiving speaking fees or grant support from Purdue, became public advocates, reassuring their peers that OxyContin was a medical miracle, not a public health risk. And all the while, the numbers soared. In just 5 years, OxyContin went from $48 million in sales to over $1 billion annually. Purdue saturated the market with higher dose formulations, and the Sackler family's wealth skyrocketed. The drug became one of the most widely prescribed and widely abused medications in the United States. What the public didn't see were the internal memos warning about the drug's street value, or the complaints from patients who were experiencing withdrawal, but being told they needed more, not less. OxyContin wasn't designed to end pain. It was designed to never let go. OxyContin wasn't just marketed, it was institutionalized. Once Purdue had a blockbuster drug, the Sacklers went to work embedding it into the very system meant to regulate it. They didn't just advertise to doctors, they educated them. Purdue paid for continuing medical education programs that taught pain was being undertreated and that opioids like OxyContin were the solution. These courses were presented as neutral science. They weren't. Purdue also funded dozens of so-called pain advocacy groups, organizations that appeared grassroots but were largely built to echo Purdue's message. These groups published pamphlets, spoke at conferences, and lobbied lawmakers, pushing the narrative that chronic pain was an epidemic and that opioids were the compassionate answer. Behind the scenes, Purdue quietly influenced clinical guidelines. Medical boards, journals, and professional associations began shifting their standards. Pain became the fifth vital sign, a movement backed by industry dollars. Doctors were encouraged, even pressured, to treat pain more aggressively, often with opioids as a first-line solution. Patient satisfaction surveys began including pain scores, further incentivizing physicians to medicate quickly and thoroughly, even when it wasn't necessary. The result? An entire generation of physicians was trained under a system that had been softly purchased. Meanwhile, Purdue lobbied the FDA to approve broader labels for OxyContin and succeeded. The company's messaging that the drug was less addictive due to its time-release formula was never scientifically proven, but it ended up baked into how the drug was understood. Purdue also sought and received approval for high-dose formulations that greatly increased the risk of dependency and overdose. And all of this was done under a veil of respectability. While Purdue marketed the drug, the Sackler name was nowhere near it. Instead, they focused their public image on philanthropy. Millions of dollars flowed into prestigious universities, museums, and hospitals. The Sackler name was etched into the wings of art galleries, medical schools, and science institutes around the world. To the public, they weren't drug profiteers. They were patrons of science and culture. This wasn't just reputation laundering, it was a shield. Criticism of Purdue could be waved away with credentials. Government officials and medical professionals often had ties directly or indirectly to institutions bearing the Sackler name or benefiting from Purdue's financial support. Whistleblowers were silenced. Questions were deflected. And behind the scenes, the system kept expanding. By the early 2000s, OxyContin wasn't just a drug. It was a doctrine embedded in medicine, policy, and practice. And the people who built it? They were nowhere to be seen. By the early 2000s, the warning signs were no longer whispers. They were everywhere. Doctors began to notice patterns. Patients who had never shown signs of addiction were returning early for refills, demanding higher doses, or exhibiting withdrawal symptoms. Emergency rooms saw an uptick in overdoses. Rural towns were reporting spikes in crime, unemployment, and overdose deaths, all linked to the same pill, OxyContin. But inside Purdue Pharma, the narrative remained unchanged. The drug was fine. The problem was the people. Rather than acknowledge growing abuse, Purdue executives blamed drug abusers who were supposedly misusing the medication. They argued that addiction stemmed from a criminal element, not the drug itself or its marketing. Internally, however, memos told a different story. Sales teams knew the pill was being crushed and snorted. They knew it had a black market nickname, hillbilly heroin. They even tracked which doctors were writing the most prescriptions, often rewarding those in communities hardest hit by addiction. The damage wasn't just medical, it was personal. Entire families were torn apart. Parents buried children. Grandparents raised grandchildren. Small towns that once revolved around mills, factories, and farms now saw their economies revolve around pain clinics, rehab centers, and funeral homes. Addiction wasn't a moral failure. It was a chemical trap, prescribed by a trusted system and pushed by a billion-dollar machine. As reports mounted, states began to investigate. Lawsuits were filed by attorneys general, alleging Purdue had misled the public about the drug's safety. A trove of internal documents would later reveal that Purdue knew as early as the late 1990s that OxyContin was being widely abused and actively covered it up. In 2007, the first reckoning came. Purdue Pharma pled guilty in federal court to criminal charges of misbranding OxyContin. 3 top executives were individually charged. The company paid $634 million in fines. It was one of the largest pharmaceutical settlements in U.S. history at the time. But the Sackler family, they weren't charged. They didn't testify. They weren't even present. Publicly, Purdue expressed regret. Privately, it was business as usual. The company doubled down on its marketing. It developed tamper-resistant pills but promoted them just as aggressively. The epidemic didn't slow down. In fact, it evolved. As access to prescription opioids tightened, millions of addicted patients turned to heroin, and eventually fentanyl, an even more lethal synthetic opioid. The pipeline Purdue helped build had no off switch. By 2010, entire regions of the U.S. were devastated. In some counties, overdose deaths outnumbered births. Generations were lost to addiction, hospitals strained, foster care systems overflowed, and communities were left asking one question: how did this happen? The answer wasn't just one pill. It was an industry that looked away and a family that made billions while the country unraveled. For years, the Sackler family had been untouchable, hidden behind museum walls, university lecture halls, and hospital wings etched with their name. They were known not as drug lords, but as philanthropists, visionaries, humanitarians. But that mask couldn't hold forever. As investigative journalists began combing through sealed court filings, whistleblower accounts, and leaked emails, the carefully maintained illusion of distance between the Sacklers and Purdue Pharma collapsed. The family hadn't just owned the company, they had actively directed its most aggressive strategies. Internal communications showed family members approving marketing campaigns, pushing for higher sales quotas, and even discussing how to turbocharge OxyContin prescriptions in high-volume areas. The Sacklers weren't passive beneficiaries. They were architects. Later in 2010, the public backlash had reached a boiling point. Protesters began targeting institutions bearing the Sackler name. Activists staged die-ins at the Metropolitan Museum of Art. Artist Nan Goldin led a global campaign to force cultural institutions to cut ties with the family. And one by one, they did. The Louvre removed the Sackler name. So did the Tate, the Guggenheim, and the British Museum. Harvard, Tufts, and other universities began reviewing or rejecting Sackler funding. Philanthropy, once a shield, became a spotlight. Legal pressure intensified. Dozens of states filed lawsuits, accusing the Sacklers not only of deceptive marketing, but of siphoning billions out of Purdue and hiding it in offshore trusts. They moved money through shell companies, private foundations, and European banking havens, protecting their fortune while claiming bankruptcy for their company. In court filings, they referred to the opioid crisis as an unfortunate chapter, avoiding any admission of direct wrongdoing. In 2019, Purdue Pharma filed for Chapter 11 bankruptcy. As part of the settlement process, the Sacklers agreed to pay billions in damages but demanded and received immunity from future civil lawsuits. It was a legal maneuver that shocked the public. The architects of a national health disaster would never face a jury. Their empire didn't collapse. It quietly restructured. The Sacklers remain billionaires, but their name, once a symbol of elite generosity, is now linked with devastation, corruption, and corporate impunity. In classrooms and courtrooms, their story has become a case study in how power protects itself. They built their fortune on pain and tried to hide it in marble. The Sacklers may be out of the headlines, but the damage remains. Over 500,000 Americans have died from opioid overdoses since the late 1990s. Millions more continue to struggle with addiction, grief, and chronic pain. Whole communities have been hollowed out not by war or famine, but by something legal, FDA approved, and heavily marketed in glossy brochures. And yet, the system that allowed it all to happen is still intact. OxyContin wasn't just a pill, it was a model, a blueprint for how to take control of an industry by shaping the science, buying the narrative, and owning the institutions meant to provide oversight. The Sacklers didn't invent that approach, but they perfected it. They showed how a product could be turned into a movement, how marketing could masquerade as medicine, how philanthropy could wash away corporate misconduct, and how, with enough money and enough silence, a public health crisis could be engineered and monetized. Even in disgrace, the Sackler name continues to haunt the medical world. Their tactics inspired others. Other pharmaceutical companies mirrored Purdue's strategy, pushing their own synthetic opioids into the market, lobbying for looser regulations, and funding studies that echoed whatever conclusion they needed. In many ways, we're still living in the house the Sacklers built, even if their portraits have been taken down. Today, Purdue Pharma no longer exists in its original form. The company has been reorganized into a public benefit corporation, with proceeds meant to help address the very crisis it helped create. But for many, that feels like too little, too late. The Sacklers have walked away with billions protected by legal firewalls, offshore trusts, and a system that still struggles to hold power accountable. Their legacy isn't just what they built. It's what they taught others was possible, and what they proved could be gotten away with. In boardrooms, courtrooms, and marketing decks, their blueprint still echoes. The empire fell, but the playbook survived. The Sacklers never wore lab coats. They weren't chemists working in back rooms or physicians treating patients. They were businessmen, ones who understood that in America, a powerful story paired with enough money can reshape not just an industry, but a culture. They told doctors that pain was a vital sign. They told regulators that addiction was rare. They told the public that they were philanthropists. And for a long time, everyone believed them. This wasn't a glitch in the system. This was the system functioning exactly as it was designed. Profit first, accountability last, if ever. The story of the Sacklers isn't just about one family's rise and fall. It's about how institutions, hospitals, universities, governments can be bought. It's about how suffering can be sold as progress. And it's a warning. If a billion-dollar lie is wrapped in enough prestige, it won't just survive, it'll thrive. If stories like this matter to you, stories that dig beneath the headlines and challenge the people who profit in the shadows, then like, subscribe, and turn on notifications. Because some families build fortunes. Others build empires of silence. And those are the ones we need to talk about.